Many people over the age of 60 say the same thing. I feel worse in the morning after taking my blood pressure medication. They feel dizzy, weak, off balance, sometimes foggy or anxious. By late morning or early afternoon, those feelings often fade. They begin to wonder if the medication itself is the problem. Some people quietly skip doses. Some delay medication without telling their doctor. Others worry that their body can no longer tolerate treatment. In most cases, the medication is not failing, and it is not harming you. The problem is timing. Mornings are the most unstable period for blood pressure after 60. Circulation is changing. Hydration is low. Hormones are rising. Medication taken during this window can feel stronger, even when it is working exactly as designed. In this video, we will explain why blood pressure medications often feel worse in the morning, what is happening inside the body during those first hours of the day, and how to talk to your doctor safely without stopping medication. This is not about fear. It is about understanding patterns so you can manage them calmly. Many people over the age of 60 begin their day with a familiar concern. They wake up, reach for their blood pressure medication, and take it exactly as prescribed. They want to do the right thing. They want to stay consistent and responsible. Within a short time, something feels off. When they stand up, they feel lightheaded. Their legs feel weak or heavy. Their head feels foggy, as if thinking clearly takes more effort than usual. Sometimes the sensation is mild. Sometimes it is strong enough to make them sit back down. Either way, it is uncomfortable. And because it happens shortly after taking medication, the connection feels obvious. This pill makes me feel bad in the morning. Later in the day, the story often changes. By late morning or early afternoon, balance improves. Energy returns. The fog lifts. The body feels more stable. When blood pressure is checked at that time, the numbers often look fine. This contrast creates confusion. If the medication is the problem, why does it only feel bad in the morning? If the medication works later, why does the body struggle early in the day? Over time, this pattern can create quiet anxiety. Some people begin to delay their dose until they feel more awake. Others skip medication on days when they feel especially weak. Some do not tell their doctor because they are unsure how to explain something that feels inconsistent. What many people do not realize is that these morning symptoms are often not a sign that the medication is harming them. They are a sign that the medication is interacting with a body that is still unstable from sleep. To understand why mornings feel worse, it helps to understand what the body is already dealing with before medication is even introduced. When you wake up, your body is not starting from a neutral position. Blood pressure naturally rises in the early morning hours. Hormones that promote alertness increase. The nervous system becomes more active. Blood vessels tighten slightly to improve circulation to the brain. In younger adults, this transition is smooth and well controlled. After 60, the transition becomes more fragile. Blood vessels are stiffer. The nervous system reacts more strongly. Circulation takes longer to stabilize. At the same time, the body is usually dehydrated after sleep. Blood volume is slightly lower. This means blood pressure regulation is already more sensitive before medication is added. When blood pressure medication is taken during this unstable period, it does not act alone. It interacts with a system that is still adjusting. The medication works to lower blood pressure. The body works to raise pressure to maintain circulation to the brain. These opposing forces create a temporary imbalance. This is why people often feel dizzy, weak, or foggy in the morning. The medication is doing its job, but the body has not yet settled into a stable state where that job feels comfortable. Later in the day, hydration improves. Circulation stabilizes. Hormonal activity becomes more balanced. When the same medication is active under these conditions, the body tolerates it much better. This explains why morning symptoms fade without any change in dosage. The medication did not stop working. The body simply caught up. Doctors see this pattern often. It is one of the most common reasons patients report side effects that seem to disappear by midday. In most cases, it does not mean the medication is wrong. It means the timing is challenging. Understanding this distinction is important. When people assume the medication itself is harmful, they may stop or alter treatment without guidance. This can increase cardiovascular risk unnecessarily. The goal is not to push through discomfort or ignore symptoms. The goal is to recognize that morning symptoms often reflect timing and physiology, not medication failure. Once this is understood, safer solutions become possible. Adjusting routines, hydration, posture, and timing can often reduce symptoms significantly without changing the medication itself. In the next part of this video, we will look more closely at what happens when blood pressure medication is taken immediately after waking and why that specific timing creates problems for many people after 60. For many people over the age of 60, taking blood pressure medication first thing in the morning feels like the responsible choice. The pill is placed on the nightstand. It is the first thing they see when they wake up. Taking it immediately feels disciplined, organized, and safe. There is often a fear behind this habit. People worry that delaying medication could cause blood pressure to rise dangerously. They do not want to forget. They do not want to miss the window. So they take the medication as soon as their eyes open, sometimes even before sitting up fully. At first, this routine feels fine. It becomes automatic. Wake up, reach for the pill, swallow it with a sip of water, then stand up and begin the day. But for many people, this is when discomfort begins. Within minutes, they feel weak or lightheaded. Standing feels harder than usual. Walking to the bathroom or kitchen feels unsteady. Some people feel a sudden heaviness in the legs. Others feel a strange sense of pressure in the head or chest, even though nothing actually hurts. Because these sensations appear shortly after taking the pill, the mind makes a quick connection. The medication must be too strong. Or, my body doesn't tolerate this anymore. Some people respond by sitting or lying back down until the feeling passes. Others push through it, telling themselves it will get better once they get moving. In many cases, the symptoms do improve after some time, but the morning remains uncomfortable. Over days and weeks, this pattern becomes emotionally exhausting. People begin to dread taking their medication. Some quietly change their routine. They delay the pill until later in the morning. Others skip it on days when they feel especially weak. Many do not tell their doctor because they feel unsure how to explain a symptom that comes and goes. What makes this even more confusing is that later in the day, everything often feels normal. Blood pressure readings look acceptable. Energy returns. Balance improves. It feels as if the medication works perfectly well, just not in the morning. This leads many people to believe the problem is unpredictable or personal. In reality, it is neither. The problem is timing. To understand why taking blood pressure medication immediately after waking can feel so uncomfortable, we need to look at what the body is doing during those first moments of the day. When you wake up, your cardiovascular system is already in a state of transition. Blood pressure naturally rises in the early morning hours as the body prepares for activity. Hormones increase alertness. The nervous system becomes more active. Blood vessels adjust to prepare for standing and movement. At the same time, the body is adjusting to gravity. When you move from lying down to sitting or standing, blood shifts downward toward the legs. To keep blood flowing to the brain, the heart and blood vessels must react quickly. After 60, these adjustments are slower and less precise. Blood vessels are stiffer. The nervous system may overreact or underreact. Circulation takes longer to stabilize. Now add blood pressure medication to this already unstable system. Most blood pressure medications work by lowering pressure, relaxing blood vessels, or reducing the force of the heartbeat. When these effects begin, while the body is still trying to raise pressure to maintain circulation to the brain, the result can feel uncomfortable. The medication lowers pressure. The body raises pressure to compensate. This internal tug-of-war creates symptoms. Dizziness, weakness, and fogginess are not signs that blood pressure is dangerously low. They are signs that circulation is temporarily struggling to balance competing signals. This is especially noticeable when medication is taken before the body has had time to stabilize. Standing soon after taking medication amplifies the effect. Gravity pulls blood downward at the same moment medication reduces pressure, making it harder for the brain to receive consistent blood flow. Later in the day, this conflict no longer exists. Hydration improves. Circulation stabilizes. Hormonal activity becomes more balanced. Under these conditions, the same medication feels much easier to tolerate. This explains why people often feel worse in the morning and fine by afternoon without any change in dose. The medication did not suddenly become stronger. The body simply became more stable. Doctors see this pattern frequently. It is one of the most common reasons patients report side effects that only happen in the morning. In most cases, the medication itself is appropriate. The issue lies in when and how it is taken. Understanding this difference is critical. When people assume medication is the problem, they may stop treatment or reduce doses without guidance. This can increase the risk of stroke, heart attack, or other complications. The safer approach is to recognize that immediate morning dosing can feel harsh because the body is not ready yet, not because the medication is wrong. In the next part of this video, we will look at another factor that makes morning medication feel even stronger: dehydration, and why taking blood pressure medication before restoring fluids can intensify side effects after 60. Many people over the age of 60 wake up and begin their morning without thinking about hydration at all. They do not feel thirsty. Their mouth does not feel dry. There is no strong signal telling them they need water right away. So they move on. They get out of bed. They take their blood pressure medication. They walk to the bathroom or kitchen. Some drink coffee or tea. Some eat breakfast. Water, if it comes at all, comes later. Within a short time, they begin to feel uncomfortable. Standing feels harder than expected. Their head feels light or heavy at the same time. Their body feels weaker than it should this early in the day. The sensation is difficult to describe. It is not pain. It is not nausea. It is a general feeling that something is off. Because this feeling often appears after taking medication, many people assume the medication is too strong. Some describe it as feeling hit harder in the morning. Others say the pill feels different than it does later in the day. As the morning goes on, the discomfort usually fades. By late morning or early afternoon, the body feels steadier. Energy improves. Balance returns. When blood pressure is checked later, the numbers often look acceptable. This cycle repeats often enough that people become frustrated. Why does the same medication feel harsh in the morning but fine later? Why does the body struggle early in the day, even when the dose never changes? The missing piece is often hydration. After sleep, the body is almost always mildly dehydrated. Even if you drank enough water the day before, fluid is lost overnight through breathing and the skin. By morning, blood volume is slightly reduced. For many people, over 60, this reduction matters more than they realize. Blood pressure depends not only on how hard the heart pumps, but also on how much fluid is circulating in the bloodstream. When blood volume is lower, the cardiovascular system must work harder to maintain stable circulation, especially to the brain. In younger adults, mild dehydration is easily compensated. Blood vessels respond quickly. The heart adjusts smoothly. Circulation remains stable. After 60, this compensation becomes less efficient. Blood vessels are stiffer. The nervous system reacts more strongly. Small changes in volume create larger changes in pressure and circulation. When blood pressure medication is taken in a dehydrated state, its effects feel amplified. The medication works to lower pressure or relax blood vessels. Dehydration reduces blood volume. Together, these effects make it harder for the body to maintain steady blood flow, particularly when standing or moving. This is why dizziness and weakness are so common in the morning. It is not that blood pressure is dangerously low. It is that circulation to the brain is temporarily less reliable. Dehydration also affects how medication is absorbed and distributed. With less fluid in the bloodstream, medication concentration can feel stronger initially, even though the dose has not changed. This can intensify early side effects. Now consider the typical morning routine again. A person wakes up already mildly dehydrated. They take their blood pressure medication immediately. They stand and begin moving around. Gravity pulls blood downward. Medication lowers pressure. Blood volume is still low. The cardiovascular system is forced to manage multiple challenges at once. Later in the day, this situation changes. Fluids are consumed. Blood volume improves. Circulation stabilizes. Under these conditions, the same medication feels much gentler. Side effects fade, even though the medication is still active. This explains why many people say, the medication feels too strong in the morning, but fine later. The medication is not changing. The body is. Doctors see this pattern frequently, especially in older adults who take diuretics or medications that affect fluid balance. In these cases, morning dehydration can significantly amplify symptoms. The solution is not to stop medication or reduce the dose without guidance. The safer solution is to recognize hydration as part of the treatment environment. Restoring fluids before or around the time medication is taken can dramatically improve tolerance. Even a single glass of water can increase blood volume enough to reduce dizziness and weakness. Hydration also helps blood vessels respond more predictably, smoothing pressure changes and improving circulation to the brain. This does not eliminate the medication's effect. It supports it. Many people who address morning hydration notice that medication suddenly feels normal again. Mornings become easier. Standing feels steadier. The sense of being overwhelmed early in the day decreases. These changes are subtle but meaningful. They reduce unnecessary discomfort and lower the risk of falls, which is especially important after 60. Understanding the role of dehydration shifts the conversation. The medication is not the enemy. The environment in which it is taken matters. In the next part of this video, we will look at another common factor that makes morning medication feel worse: standing, moving, or rushing too quickly after taking blood pressure medication, and why posture and timing play a critical role in how the body responds. For many people over the age of 60, the morning feels like a narrow window of time. There is a sense that once the day starts, it moves quickly. Because of this, many people take their blood pressure medication and immediately begin moving. They stand up, they walk to the bathroom, they start preparing breakfast, they move from room to room without pausing. This feels normal. It feels productive. Sitting still after taking medication feels unnecessary, even wasteful. There is often a quiet pressure to get going, so the day does not fall behind. But this is often when discomfort begins. As people stand and move, they may feel suddenly lightheaded. Their vision may dim for a moment. Their legs may feel weak or unstable. Some people feel a wave of fatigue that seems out of proportion to the effort they are making. These sensations are unsettling. They can appear suddenly and without warning. Many people respond by grabbing onto furniture, sitting back down, or slowing their movement. Others push through, assuming the feeling will pass if they keep moving. Because these symptoms often appear right after medication and movement, people again blame the medication. They think, "This pill makes me feel unsteady," or "My body can't handle this anymore." Later in the day, the same people can stand, walk, and move freely without any problem. This contrast deepens the confusion. Why does the body struggle so much in the morning, but feel strong later? Over time, this pattern can create fear of movement. Some people become cautious about standing too quickly. Others avoid activity in the morning altogether. In more serious cases, people experience falls, which can lead to injuries and a loss of confidence. What many people do not realize is that the combination of medication, posture, and timing plays a powerful role in how the body responds during the morning hours. To understand why standing and moving too quickly can make blood pressure medication feel worse, it helps to look at how the body manages circulation. When you are lying down, blood is distributed evenly throughout the body. The heart does not have to work against gravity to supply blood to the brain. Blood pressure is relatively stable. When you stand, gravity immediately pulls blood downward toward the legs. To prevent blood pressure from dropping in the brain, the body must respond quickly. Blood vessels tighten. Heart rate increases. Blood pressure adjusts upward. In younger adults, this response is fast and precise. After 60, it becomes slower and less reliable. Blood vessels are stiffer. The nervous system may react too strongly or too slowly. This makes standing transitions more challenging. Now add blood pressure medication to this situation. Most blood pressure medications lower pressure by relaxing blood vessels, reducing heart rate, or decreasing the force of the heartbeat. These effects are helpful over the long term, but they can interfere with the body's ability to compensate quickly when standing. When a person takes medication and then stands or walks immediately, two things happen at once. Gravity pulls blood downward. Medication limits the body's ability to raise pressure quickly. The result is a temporary reduction in blood flow to the brain. This is what causes dizziness, weakness, and instability. This effect is strongest in the morning because circulation is already unstable. Hydration is low. Hormones are shifting. The nervous system is still adjusting from sleep. Under these conditions, even small changes in posture can have large effects. Rushing makes the situation worse. Rapid movements give the cardiovascular system less time to adapt. Each step demands a quick adjustment that the body may not be ready to make. Later in the day, the same movements feel easy. Blood volume has improved. Blood vessels are more responsive. The nervous system is calmer. Medication effects are better integrated into a stable system. This explains why morning symptoms disappear without any change in medication. The body simply becomes more capable of handling posture changes as the day progresses. Doctors often see this pattern in older adults who report morning dizziness or falls. In many cases, the solution is not changing the medication, but changing the sequence of actions in the morning. Allowing time between taking medication and standing can make a significant difference. Sitting quietly for a few minutes, moving the legs gently, standing slowly. These simple adjustments give the cardiovascular system time to respond. This is not about weakness or aging poorly. It is about recognizing that the body's timing has changed. Respecting that timing reduces strain and improves safety. When posture and movement are managed thoughtfully, blood pressure medication often feels much easier to tolerate. Morning dizziness decreases. Confidence in movement returns. The fear associated with morning routines fades. In the final part of this video, we will bring all of these pieces together. We will talk about how to approach your doctor with these concerns, how to adjust routines safely without stopping medication, and how small changes can protect your health over the long term. By now, a pattern should be becoming clear. For most people over the age of 60, feeling worse after taking blood pressure medication in the morning does not mean the medication is harmful. It means the body is going through its most unstable period of the day at the exact moment the medication begins to work. Mornings combine several challenges at once. Blood pressure is naturally rising. Hydration is low. Circulation is adjusting to standing and movement. Hormones that affect alertness and stress are increasing. When medication is introduced during this window, its effects can feel stronger, faster, and more uncomfortable. This understanding changes everything. Instead of asking, "Is my medication wrong?" the more useful question becomes, "Is my morning routine supporting how this medication works?" Many people feel relieved when they realize that the discomfort they experience is not a sign of damage or failure. It is a sign of timing and interaction. The medication is doing its job, but the environment around it needs adjustment. The goal is not to eliminate all symptoms immediately. The goal is to reduce unnecessary strain and make mornings safer, calmer, and more predictable. One of the most important principles is sequence. What you do first in the morning matters more than what you do later. Small changes in order can have a large impact on how your body responds to medication. For example, allowing your body time to wake up before taking medication can make a meaningful difference. Sitting quietly for a few minutes after waking. Restoring fluids with a glass of water. Letting circulation stabilize before standing or moving quickly. These actions prepare the body to handle medication more smoothly. This does not mean delaying medication indefinitely or changing prescribed instructions on your own. It means understanding that how medication is taken is just as important as what is taken. Hydration is another key factor. Many people underestimate how much mild dehydration affects circulation after 60. Taking medication when blood volume is low makes side effects more likely. Restoring fluids first supports blood flow and reduces dizziness and weakness. Posture also matters. Standing up slowly, pausing between positions, and avoiding rushing immediately after taking medication gives the cardiovascular system time to adjust. These small pauses protect the brain from sudden drops in circulation and reduce the risk of falls. Stress and mental stimulation play a role as well. Starting the day in a rushed or anxious state activates the nervous system, raising blood pressure and making medication effects feel more intense. Calmer mornings lead to smoother transitions. None of these changes require new medications, supplements, or complicated routines. They require awareness and patience. It is also important to remember what not to do. Do not stop blood pressure medication on your own because of morning discomfort. Sudden changes can increase the risk of serious events, such as stroke or heart attack. Even skipping doses occasionally can destabilize blood pressure over time. Do not assume that feeling better later in the day means the medication is unnecessary. The goal of treatment is long-term protection, not short-term comfort alone. Instead, observe patterns. Pay attention to when symptoms appear and when they fade. Notice how hydration, posture, and timing affect how you feel. This information is valuable, especially when shared with your doctor. When talking to your healthcare provider, clarity matters more than complaints. Rather than saying, "This medication makes me feel bad," try describing the pattern. "I feel lightheaded and weak in the first hour after taking my medication in the morning, but I feel fine later in the day." This gives your doctor useful context. It signals that the issue may be timing or interaction rather than intolerance. You can also ask specific questions, such as, "Is there a better time of day to take this medication? Should I adjust my morning routine to support how this medication works? Would hydration or posture changes help reduce these symptoms?" Doctors hear these concerns often, especially from older adults. In many cases, small adjustments are enough to improve comfort without changing the medication itself. Sometimes, a doctor may suggest a different dosing schedule. Sometimes they may recommend splitting doses or adjusting timing. These decisions should always be made together, not alone. The most important thing is that you are not powerless in this process. Understanding how your body changes after 60 allows you to work with medication instead of against it. The goal is not to fight aging, but to adapt intelligently to it. Many people who make small changes to their mornings report meaningful improvements. They feel steadier when standing. Morning dizziness decreases. Confidence returns. The fear associated with taking medication fades. These improvements may seem modest, but over time, they matter. They reduce stress on the cardiovascular system. They lower the risk of falls. They support long-term heart and brain health. A calm morning is not a luxury after 60. It is a protective strategy. If this video helped you understand why mornings feel worse with blood pressure medication, take that understanding with you tomorrow. You do not need to change everything at once. Choose one small adjustment. Let it become familiar. Then consider another. This channel exists to provide calm, clear guidance for navigating health after 60 without fear or confusion. Aging brings change, but it also brings the opportunity to make wiser, more intentional choices. If you found this video helpful, consider subscribing. New videos focus on senior health, blood pressure patterns, medication timing, and daily habits that quietly protect your independence and well-being. In the next video, we will talk about how to build a morning routine that supports blood pressure naturally, without stress or extremes. Thank you for spending this time focusing on your health. Understanding your body today is one of the most effective ways to protect the years ahead.